Well, first of all, healthcare is a very important issue for all of us. It's an issue that's important not just to elderly people or young people, but it's important to all of us because it represents the values of who we are as a country. I believe that we ought to look at healthcare for our children first and foremost. Children that need healthcare on a day-to-day basis. We have an obligation to our elderly people, to our elderly parents, grandparents, to have healthcare for them. We should support a program that gives them the opportunity to have healthcare, and at the same time, ensure that what we're doing in New Mexico is in line with what will happen at the national level. My biggest concern would be that we do something at the state level that contradicts what's happening at the national level, and then we find ourselves in a position that we cannot meet the obligations that we have told our citizens are important to us. This healthcare legislation ought to be legislation that works hand in hand with the federal government. And if the federal government won't lead, then we need to lead at the state. Because at the end of the day, our federal government needs to hear our voices loud and clear. That healthcare is important for all of us, and we ought to take the step to make the decision and to move forward. So from my perspective, if the healthcare legislation is important for the country ought to respond, and if they don't, then we should do that in New Mexico.